the mark. Been reaching from the start. I'll be victorious. Bring on the sticks and stones. I've learned to take control. You'll never break my soul. I'll be victorious. Watch me break through every wall. See it crumble down. You won't ever see me fall. No, 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 no.
Good morning. I'm Diana Sevilla, and I will be your MC for today. Thank you so much for coming to Equity on the Mall 2021. To kick us off, we will start with a few housekeeping items. Today's event will be a virtual multilingual space in English, Spanish, Hmong, and Punjabi. In just a minute, after we finish giving out the following instructions, we will activate the Zoom interpretation feature. These instructions will also be repeated in the 3 languages. When we turn on the interpretation feature for Zoom, if you are on a computer, you will see a globe pop up on the bottom of the screen. If you're on your phone, you will see 3 dots on the bottom, right-hand side of your screen. Click on these and select the language that you speak. If for some reason the original speaker sounds louder than the interpreter you are listening to, you can select the option to mute the original audio at any moment. And now, I will bring up each language interpreter to share these instructions, starting with Spanish, then Hmong, and then Punjabi. Let's begin with our Spanish interpreter. Thank you. Now let's follow with our Hmong interpreter. Can we now have the Hmong interpreter? Okay. Okay. Thank you. Lastly, let's hear from our Punjabi interpreter. Thank you all. Now we will turn on the interpretation settings. Please remember to select your language channel and feel free to use the chat box for any questions or tech issues. And now, to get our energy up for the rally, we have some amazing entertainment. McCoy Hip Hop is a family-oriented, multicultural dance company for children ages 5 through 18 that specializes in building confidence, self-esteem through the language of music and dance, while stressing the importance of higher education, leadership, teamwork, and community involvement. We are so excited to have McCoy Hip Hop Collective share some of their talent and moves with us today. Take it away. That was fire. Thank you, McCoy Hip Hop Collective, for getting the energy up for a fantastic program today. Now, here to welcome you all is Sierra Health Foundation President and CEO, Chet Hewitt.
Good morning, everyone. I hope you're as excited about Equity on the Mall as I am. But before we get started, I'd like you to just bear with me for a moment. I'd like for us to have a moment of silence, both in remembrance and to honor all those that we've lost over the past 15 months to the pandemic and COVID-19, but also to honor all of the essential workers who stood up and made sure that we were as safe and as healthy as we could possibly be. So before I open my brief remarks this morning, would you please join me in a moment of silence, honor, and remembrance. I want to welcome you all here today to Equity on the Mall. And while there aren't 2,500 of us gathered on the mall, screaming to the rafters of the Capitol why we are there to fight injustice and equity across the San Joaquin Valley, our energy and our commitment is still being felt. Last year, folks said to me that we had missed the day of Equity on the Mall. And I said, that's actually not quite true. While Equity on the Mall did not take place in Sacramento, we pivoted and turned our energy and our commitment to the communities that we know who needed the most help and assistance, given what we would face over the course of the pandemic. Tragically, all of the things that we had been advocating for years before, the battle against injustice, the battle for inclusion, showed up on our doorsteps across this country, regardless of the community that you lived in. In many respects, our plea for investment and support and to honor the contributions of folks who live across the San Joaquin Valley was made more real and more true than anyone could have imagined. Inequality showed up in places that hadn't been seen before. The stories that we had told in past years was made more powerful, more relevant, and more visible. And unfortunately, with some very tragic circumstances. So we are back this year to continue our fight and to put it up front and center for our legislators who work across California in order for them to remember that the San Joaquin Valley is rising, and that life in the San Joaquin Valley can be improved, and not just by what they do in Sacramento, but it needs to include the leadership, the ideas, the motivation, and the participation of community leaders and community residents from across the valley. I want to congratulate all of you today on the updating of the I-HEAL framework: immigration, health, housing, education, environment, and land use and planning. And to salute the leaders who are now focusing on issues around broadband and disadvantage, as well as focusing on a response to COVID. The San Joaquin Valley Health Fund has grown to over 40 funders, 160 community partners, and investments totaling $29 million, $7 million of which was been invested directly in response to the COVID pandemic. All those numbers are great, but the most important and powerful aspect of the San Joaquin Valley Health Fund and Equity on the Mall is you. Each and every one of you, your voices, your hopes, your aspirations for a preferred future is what Equity on the Mall and the San Joaquin Valley Health Fund is all about. We at the Sierra Health Foundation are honored to be partners with you in this incredible work. And as part of the funders community, I can say that we recognize that the most incredible piece about this particular work is that it is led by community leaders and residents, with foundations operating in partnership with all of you. I want to welcome you to this week of action, to this week where we will continue to give voice and importance to the issues we know are germane across the Valley. And as we begin this week, I want you to make sure you stay committed and participate in all of the events that will take place over the next 4 days. I'd like to end here and turn it over to Emmy and Eileen, who are the co-chairs of the policy committee that actually put together this year's policy platform. Let's have a great Equity on the Mall.
Good morning, everyone. My name is Eileen Espejo from Children Now. And with Noe, we are the co-chairs of the governance subcommittee for the policy committee that has worked to bring you this week's virtual Equity on the Mall event. The policy committee has worked extremely hard to finalize the iHeal policy platform and to bring you this week's events. I hope you are all registered for what will be a full and productive and fulfilling week ahead, to learn about our challenges and successes, to celebrate the work that we have accomplished, and the work that we need your help and support in order to achieve. Thank you again for being here. I'll now hand it off to Noe to share his thoughts and to introduce our next speaker.
Good morning, I'm Noé Páramo. On behalf of the San Joaquin Valley Health Fund partner organizations, welcome to the first virtual Equity on the Mall 2021. Last year's Equity on the Mall was postponed due to the COVID-19 pandemic. Since then, the Sierra Health Foundation has led the way with resources and funding to our community-based organization partners, and also working with the state academic and foundations to elevate our most important organizations, helping our communities fight COVID-19 pandemic on the ground. The policy committee worked tirelessly over the last few months, meeting regularly to address the needs and challenges of our families, as well as updating the platform. This has been a difficult year. We want to thank Chet, Cayenne, Chris, Eileen, Ellen, Diana, Lee, her, and all their staff, as we are here virtually because the pandemic is not over. So on our behalf, the governing committee, thank you. We invite you to join us in this exciting week of activities. I will now like to introduce Congressman Josh Harder. He's leading us in Washington, D.C. with his work to help our San Joaquin Valley communities. And he has recorded his thoughts for us to share. Thank you very much. And I now introduce Congressman Josh Harder, District 10.
Hey everybody, I'm Congressman Josh Harder. Thank you so much for inviting me to speak at Equity on the Mall. To all of the healthcare workers, support staff, nonprofit workers, advocates, community members here, thank you for joining us. After an incredibly tough and tragic year, I hope you're all seeing the light at the end of the tunnel. We're almost there. I don't need to tell you about all of the inequities and lack of investment that our valley has seen over the last few decades, but I want to talk about some of the solutions that I'm working on to improve health and advance equity for families here in the valley. First, we've been very focused on vaccine distribution. Earlier this year, I noticed that wealthier counties in California, like Napa and Marin, were getting a larger share of vaccines than we were getting here in the valley. That was not right. I couldn't stand for it. I called out the state, the federal government demanded we got our fair share, and it's been working. Numbers have been improving. We've been getting more vaccines as well as a better share of the vaccines in recent weeks. And we're going to continue to work hard to ensure folks like us in the hardest hit parts of California get the vaccines that we deserve to get this pandemic under control. But here's the thing. Not only are we seeing a shortage of vaccines, we're also seeing a shortage of doctors and healthcare workers. When we were at 0% ICU bed capacity, it's not because we didn't have the physical bed space, it's because we didn't have the doctors and nurses to take care of folks. And so in many ways, and that's actually caused by a loophole in federal regulations that prevents our doctors here in California from qualifying for the same student loan repayment programs that exist in other states. I introduced a bill called the Stopping Doctor Shortages Act, which will bring 10,000 physicians to California over the next couple of years, especially in the hardest hit areas like the Central Valley. With more doctors in our community, healthcare becomes more affordable, becomes more accessible, especially for the folks that need it most. We've been working also on some of the most vulnerable parts of our community, especially farm workers in our Latino community. A couple weeks ago, I met with community leaders in San Joaquin to talk about how to make sure that our farm workers have access to the vaccine. I've heard from so many workers who were afraid to sign up for an appointment because of their immigration status. They thought they might face a choice between their health care and their status in this country. No one should have to make that choice. Which is why we've now been working with the community leaders to send mobile vaccination clinics to farms. These clinics have made the process a lot easier and less threatening for our farm workers. Our community thrives when our policies work for everybody, not just the wealthiest among us, and that's never been more true than in the midst of a pandemic that affects each and every person across our community. We're not going to stop working until we make sure that everyone has what they have to succeed, and the Valley gets the resources we deserve so our parents, grandparents, kids, neighbors can lead the healthy and fulfilling lives that we all want. So thank you all for all the work you're doing. Thank you for having me today, and best of luck with the rest of your event.
Representative Harder, it was great hearing from you. Thank you for being our voice at the federal level. It is now my pleasure to introduce our next speaker, Assemblymember Dr. Joaquin Arambula, a man who has been fighting alongside us since the beginning. Thank you for joining us, Assemblymember. Passing the virtual mic off to you.
Thank you for the opportunity to be with you all here today. I have been a proud partner of this movement since it began, and I am very pleased with all the work that we have been able to accomplish together. Our community has showed up and supported each other during this devastating pandemic. We worked tirelessly to provide our community resources to stay safe, to receive food, to receive financial assistance and vaccines, and we will come back stronger than ever. You all have become a powerful force in the state and have accomplished so much together. I want to thank you for your commitment to the fight for our communities throughout the San Joaquin Valley. I am committed to fight alongside with you and push our priorities forward in the state legislature. This year, I will continue to fight for the key priorities within the I HEAL policy platform, including AB4, which will provide full scope Medi-Cal to all income eligible adults, regardless of immigration status, by removing it as an eligibility exclusion. Currently, our undocumented Californians are facing a healthcare crisis. COVID-19 has hurt our undocumented immigrants who have borne the brunt of this pandemic. And this pandemic has further exacerbated the racial and health disparities, as well as making it clear that access to comprehensive healthcare is necessary for every resident within our state. It is critical that our state act now to protect the health of low-income Californians, regardless of where they were born. No one in our state should have to wait until an emergency to be able to access healthcare. The expansion of Medi-Cal, regardless of immigration status, to all income-eligible children in 2016 and young adults in 2020 ensured comprehensive care for hundreds of thousands of young people and a healthier California overall. Covering all adults by passing AB4 is the next logical step to close a significant gap that remains in our healthcare system. By removing immigration status as an eligibility barrier to Medi-Cal, California can build a more universal, equitable healthcare system for all who call California home. Healthcare is a human right, and our healthcare system is stronger when everyone is included. I have additionally advocated for the creation of, and now chair, the Assembly Select Committee on Ensuring Equity post-COVID-19. This pandemic has intensified the inequities that already existed in many parts of our state. As COVID-19 impacts nearly all aspects of our day-to-day lives, the ultimate goal of this select committee is to develop policy recommendations that address concerns of equity in existing federal, state, and local programs to improve upon existing injustices. I invite you to join me in helping to shape California's future to bring equity for all. Each day I fight to bring more opportunities to the Valley and continue its rise. Thank you again for this opportunity to speak, and I wish you the best of luck during your lobby day today.
We cannot thank you enough for your support and partnership, Assemblymember Arambula. I am excited now to welcome Pablo Rodriguez, the Executive Director of Communities for a New California, to the virtual stage to share with us about redistricting efforts underway in the Valley.
Good morning, everyone. Thank you. Voters should pick their elected officials. Elected officials should not pick their voters. District lines have enormous power. The Central Valley's local redistricting processes can keep people with common experiences, common histories, and common aspirations together so that we can effectively advocate for ourselves and our families and make our voices heard in local affairs. Or, at its worst, it can gerrymander our communities and silence our voices. As we see too often today, there is one side of town that has all of the resources a family needs to thrive, while on the other side of town, our families too often struggle to survive. Where lines are drawn will help determine who can win elections in the Valley for the next decade, and in turn, which communities have representation and what laws and policies are passed. Most of the attention paid in redistricting this year and the beginning of next will most likely be focused on the California Citizens Redistricting Commission, which will determine the boundaries for congressional, state assembly, and state senate lines. We risk, however, far less attention being paid to how lines are drawn for county boards of supervisors, city councils, school boards, water boards, and other local governments. School boards in small cities in particular have often redrawn redistricting lines with minimal processes and very little public awareness. Racial inequities are often created and amplified by these divisions and decisions. The lack of public interest and participation has in the past been bound to the lack of philanthropic support of local organizations implementing redistricting outreach. However, we have an opportunity to break this cycle. The state legislature has passed laws dramatically overhauling local redistricting processes, requiring greater public outreach and engagement, more accessible and inclusive redistricting processes, including transparency and line drawing criteria that puts our families first. So the stage is set to build on the successes of coalitions and civic partnerships generated by the 2020 census, and to further the cause of community power building and racial equity. Redistricting is indispensable for families of those of us here today who have historically been frozen out of the power to begin the process of structural and system change. And so I'll finish by inviting you to join organizations supported by the Sierra Health Foundation in making sure, again, that voters pick their elected officials and prevent elected officials from picking their voters during redistricting. In that way, we will ensure that we have our voice, our choice, our California. Thank you.
It was an honor having you, Pablo. We so appreciate your remarks and your leadership. Now get ready for a special performance from Collective. Under Under direction, creation of Jamila Lila Finley, Collective is an intergenerational and multi-genre unique approach to spoken word and hip hop with an acoustic band exploring themes of social justice and activism. Let's go.
Pass the torch like we used to do. 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 Keep it moving. It's a movement. Keep it moving. It's a movement. Keep it moving. It's a movement. Keep it moving.
Keep it moving, it's a movement. Spoken word in motion, smooth as cocoa butter lotion. Mess with the rhythm, it's like an elixir or a potion. Let it sink in and bring you joy. Never destroy all of your soul. Felt it since I was a boy. Break the cycle as I spit my written, let my mind flow.
Yeah, I had a dream, and it shut up in my bones within me. I say yes, I had a dream, and it shut up in my bones, shut up in my soul, shut up in my heart. All over me. It's a movement, keep it moving. It's a verb, it's an action word. Forward march, forward movement. Can't stop, won't stop, get up. Let that fire burn inside your life that guide you. Never let it die. Medgar, Malcolm, Martin, I
called it Coleman, Rosa Parks. I ain't moving, but I'ma keep it moving. You can slow me down. I'm on fire, but I'm vibing on my wave. What can I say? The torch was given to me, so I'ma get to my next sea. My faith is high, fist up to the sky. Blackness so defined. Crown makes it but never fall. My God is above it all. Meditation, a clear mind, a golden soul, fulfilling prophecies. I'm always gonna believe.
It's a movement, keep it moving. It's a movement, keep it moving. It's a movement, keep it moving. Yeah, I had a dream, and it shut up in my bones within me. I said yes, I had a dream, and it shut up in my bones, shut up in my soul, shut up in my heart.
I ain't wake up since. Yeah, I grew some wings, no need to hop a fence. I'm in the wind, as bright as the night, dark as the sun. Yeah, I'm up, never morning, I'm feeling glorious. Oh, we just people living history, for you it's just for fun. Can't sleep until the next day comes.
I can't sleep until the next day comes. I can't sleep until the next day comes. I had a dream, and it shut up in my bones within me.
Wow. Thank you very much, Collective, for that incredible performance. Good morning, everyone. I am Chris Cambises, Program Officer for the San Joaquin Valley Health Fund, and I am delighted to be joining you all and to be a part of Equity on the Mall 2021. COVID-19 has shown a light on the deep inequities in our system and within our communities. It has been incredibly inspiring to see how our community has come together to provide for each other during this time. And as we get vaccinated, we need to discuss what changes are needed to come out of the pandemic stronger. Joining us today is a group of inspirational leaders who rose to the challenge of addressing COVID-19 in their communities in incredibly innovative ways. And we have invited them to share their work and experiences through this panel. So I'm delighted to be joined by Genoveva Islas from Cultiva la Salud, Felicia Batz from the Fresno American Indian Health Project, Jennifer Chong from Hmong Innovating Politics. Welcome to all of you. So I would like to begin by offering each of you an opportunity to discuss your organization's work during the last year related to COVID-19. And what you learned about that through the process. So Veva, we'll start with you.
The story of the pandemic, I'm always muted. Let me begin by just really thanking you for the invitation. It is a pleasure to be here. I'm very grateful to be among respected and beloved colleagues, advocates here in the San Joaquin Valley, and just very grateful for the continuing support by Sierra Health Foundation in allowing us to do great work. So COVID, threw us all into just a mess in our communities. And unfortunately, and as has been reiterated at several times, our communities were already experiencing very deep inequities. Cultiva's history of work has really been around promoting healthy eating and active living, in particular for disadvantaged communities where there hasn't been access to healthy food or hasn't been safe places for people to be physically active. But we had to pivot, and we had to pivot to the direct response and immediate need that the pandemic was causing in our community. And in particular, the way we chose to dedicate our time, energy, and effort was by serving the most vulnerable in our community, elders. We decided and identified early on that those vulnerable seniors were in very precarious situations as they no longer were getting additional supports because of loss of employment and income of their social network, their children, others that they have depended on. So we actively sought out to serve undocumented elders by giving them food, direct food delivery. We gave them personal hygiene products, personal protection equipment, masks, hand sanitizer. We gave them a lot of education about COVID early on, often in the language that they needed, that they hadn't been receiving it. And we also gave them a lot of household cleaning supplies because we knew that would be things that would give them an advantage in preventing infection. So our interest was to help these very vulnerable elder seniors to shelter in place because, again, we knew that they would be the most vulnerable in contracting severe COVID if they did become infected. Second population that we worked with was children. In particular, low-income children who were really dependent on food from schools. And as schools were sheltering in place, as we were moving into the summer and they were deciding not to feed, I and colleagues who I really want to commend, the Dolores Huerta Foundation, Nutrition Policy Institute, as well as Stanford's Medical Center, really came together in doing research to identify the extent of the problem, advocating with local school districts to make sure that they did not stop feeding our children. And since then, we've also been very vocal about making sure that the way they're organizing the meals are delivered in the way that families will be able to most access and benefit from, as well as continuing to encourage healthy foods, right? Because we want our children to avail themselves to the most nutritious foods through our school meals. And that's been an ongoing fight and still a lot of work to do. So I would say, very grateful for those opportunities, definitely a lot more work to be done.
Thank you very much, Beva. Felicia, from your perspective at the Fresno American Indian Health Project.
Still haven't gotten the hang of that. Hi, good morning, everyone. My name is Felicia Batts. I'm the Director of Care Integration here at the Fresno American Indian Health Project. On behalf of our organization, our CEO, Selena De La Pena, thank you for the invitation and all the awesome grant funding you've provided us over the past year to help our clients in the community. COVID. What can we say? I think our board member put it best when he said, we've taken strong steps during these hard times. And that phrase right there actually translated into our annual 2020 report theme. And specifically around COVID, it's been interesting, definitely uncharted territory, but we saw increases in patient and client registrations. We saw increases in our encounters and services, particularly and probably not surprisingly for behavioral health services. We, like many people, will be defining how we use the new P word in our life, pivoting, and really kind of talking about how you were forced to do things differently. So specifically with our transportation services, we typically pick people up, we bring them to appointments. We no longer had in-person services, but we continued virtually. I'm so excited to hear the digital divide talk today because we've definitely experienced it. So rather than picking people up for appointments, we were delivering food to them. We were delivering their medications to them at their homes. We were delivering program materials where they had to participate for beading classes or other support groups virtually, and we had to bring them registration materials or supplies to do those activities. We worked with youth, elders, and pregnant patients virtually through virtual appointments. Telehealth got a boom, probably like for many people in the healthcare industry during this time. Virtual services are now a thing. It's not something optional, it's something that will probably be here to stay. Some of our clients, because they're elderly and because of that digital divide, didn't necessarily take well to those services being offered virtually. So we have to see, once we're able to go to their homes and re-implement our home visiting services, we have to see how we can help them to be online and really maximize services that we offer, whether it be in person or virtually, because we have to be prepared with that kind of like a backup plan. We've learned and mastered those virtual meetings. We still provided over 2,500 new client visits and patients. If COVID-19 wasn't enough, there was the Creek Fire, which created a natural disaster for many of our clients who live in the mountain communities. So we had to kick into gear of providing emergency housing and getting people into hotels as they were being evacuated from their homes, but still have some semblance of normalcy, and then transitioning them back to their homes. We stayed open. So like many healthcare organizations who rose to the task and are essential workers, we were able to stay open, still provide services, although we did have to create safety precautions and accommodations. We, in the midst of all this, completed a national charter for a Boys and Girls Club. So we have a very strong youth services program. It's very long-standing, very reputable. And because we are a Native American Indian health service organization, we have an annual event called the Gathering of Native Americans. And this was the first time in 11 years that we had to take that service virtual. So that was an experience, but we still had participation. We had to shift gears, as I mentioned, with the Creek Fire and doing some of those services for the natural disaster. But then with COVID testing and COVID vaccines, this was also new to us. We started to implement these services before we opened our new community health and wellness center. So although we now have a health and wellness center providing medical services to infants, adults, and elders, we are very adamant about still continuing to test. We know cases are going up, and still continuing to push the COVID-19 vaccines. We, like many people, have seen that initial uptake in the vaccines, but we are now plateauing and really trying to dive into the reluctance around distrust, the reluctance around miseducation and misinformation. Those are all things that are right here on our table as something we need to roll up our sleeves and try to figure out how to navigate. And then finally, the funding provided by the San Joaquin Valley Health Fund was very helpful. Like many other organizations, when you have a need for community resources, oftentimes you screen and identify those needs, and then you kind of refer or push someone else somewhere to get those services. We were fortunate with the San Joaquin Valley Health Fund funding to be able to do that in-house. So we were the one-stop shop. So when someone needed help with their PG&E, with hygiene products, with PPE, with gift cards for just essential needs and meeting essential needs, providing food, that funding was able to establish a kind of new infrastructure within our organization of helping clients and families to get those essential services. So in conclusion, we talk a lot about in terms of COVID being hard times and what it's presented for us, but we're actually very proud of how strong we've stood and how we persevered. And we're retooling and preparing for what will come next, definitely post-recovery, but we really have to stay prepared. So thank you again for inviting me.
Brilliant. Thank you very much, Felicia. And Jennifer, over to you now.
Hi, Chris. Thank you. And good morning, everyone. My name is Jennifer Zhang, and I am the Communications Associate with Hmong Innovating Politics. Chris, I'm going to have to ask you, can you kind of repeat your question that you posed with all of us?
Sure, absolutely. So I just want to start out with offering you an opportunity to describe your work over the last year as it relates to COVID-19 and how you've supported your communities.
All right, thank you. So to begin, we are a very humble grassroots organization composed of 7-8 members. And in the wake of the pandemic over a year ago, it really threw a wrench in our efforts, especially because we do so much direct outreach to our communities, both in Sacramento and in Fresno. So we had to really take a pause and reimagine what outreach was going to look like while following all the safety guidelines and how we could support our communities during this time, because there were a lot of fear, a lot of information or misinformation, or not enough correct information coming through or at the right time and being accessible to our communities. And on top of that, there were people were experiencing job loss. And additionally, we recognize that in our communities, and probably so many others, people live in multi-generational households, and that caused a lot of I would say scares and issues and prevalences of how COVID-19 can go and impact families, not only from those who are young, but all the way to those who are old, and how we can provide for our communities and support them. So in the beginning, we were able to distribute over 150 care packages filled with groceries, PPE or personal protection equipment, such as hand sanitizers, masks, also just guides and information in language, both in English and Hmong, provided in these care packages. We were able to survey our communities during the wake of this pandemic to understand their fears and what they knew or didn't know about, the COVID-19 pandemic in the beginning. And so with that, we were able to support local businesses and farmers by contracting with them and buying, their stocks of the products or items that they have. Because we also know that businesses, especially local small businesses, were really impacted during this time as well. And that was kind of like the first phase. And we also, like many other organizations, really amplified our digital communications and outreach, doing a lot of in-language translation and also audio-visual guides and videos, because we knew that those were probably most effective. And then we also tapped into ethnic media for Hmong, for the Hmong community. That includes TV and radio. So doing a lot of lives through not only our social media platforms, but through ethnic media to get in touch with our community members and keep them informed in how they can protect themselves and their loved ones. And then also just throughout the course of beginning of March, 2020, moving forward, we also were able to distribute over 200 $100 COVID cash aid relief to community members. And again, just engaging in those conversations with our community members was not only very insightful for us, but I think for them, it was extremely healing. I mean, I remember just calling one community member and she broke down in tears with me, and she told me she's never cried in front of her family, and she doesn't even know me, yet we had this 40-minute conversation, even though I was trying to survey her for a $100 cash aid gift card. And it really showed how much our communities were hurting and how much resources and support they really needed. And, I think HIP, we're really humbled and grateful that we really pulled all our efforts to do our best and support our communities in the way that we can. So aside from the $100 COVID cash aid relief, moving forward into, this new year where the vaccine rollout was implemented and was available, we knew that it was so important for us to connect our community and community members to these vaccines, and also really fight against and dispel the misinformation and the disinformation that was going around in our communities, and how we can instill trust and confidence in them to get vaccinated. And so we did create this, this online Hmong COVID-19 vaccine network. And then also we were just always bombarded with messages and getting reached out by our community members. And I think that reflected that we were their trusted messengers and you know, the agency that could connect them to the resources that they needed for their communities. And so since the beginning of February till now, we've been able to connect over 600 community members to receiving vaccine appointments. So really securing them, not just saying, hey, go get vaccinated, but it's like, how can we secure appointments for you? And additionally, on top of that, we were able to get in touch with the governor's office. And in turn, we're able to receive, I believe, around 150 individual codes that would really guarantee that community members who were in dire need of support and access to vaccines or receiving the vaccine receive this code, and we're then able to implement it or input it online through their registration and be ensured that they were guaranteed for a vaccine. And additionally, on top of that, in Sacramento, we worked very closely with Councilwoman Vang, who had been holding, I think, weekly pop-up clinics in multi-languages. So we worked closely with them and made references for our communities in Sacramento to those pop-up clinics. And inversely in Fresno, I'm really proud of our partnership with FIRM. I think we worked really closely with them to try to streamline messaging. And on top of that, we've seen the efficiency in the way that they hold their clinics every Wednesdays. And so, and we know that we also understand that, you know, even though vaccine sites or vaccines are readily available, that doesn't always equal or mirror readily accessible. And so choosing vaccine sites and locations where our communities feel safe, feel inclusive, where there is language support, such as FIRM, and I'm just gonna reiterate that again, has been super powerful in our relationship building and how we can channel our communities to go and get vaccinated at trusted sites and locations where they can also not have to worry if a worker is going to speak Hmong or not in the case that they don't speak English. And additionally, on top of that, we did receive funding, you know, graciously from Sierra Health earlier in February. And so that has been utilized to push, you know, our efforts again onto ethnic media. Just recently, last Friday, we aired a segment, an hour segment on touring FIRM's vaccine site and just showing them what the stations look like, what stage point A to point, you know, point Z or point D looks like. And so that our community members are not intimidated and know that it's not this circus or this crazy roller coaster ride you have to go on in order to, you know, register, get vaccinated. It's a super simple, easy way to get you and your families vaccinated, safe and protected. And again, just building that confidence and acknowledging the fears that they have. Because, you know, I think not acknowledging that or pushing that away is can have a negative effect and adverse effect when we're building trust and relationship for our communities to get vaccinated. So really, I think the most important thing right now is to continue to, I think, drill in the importance of following those guidelines in spite of getting your first or second dose, understanding what the process is, understanding what kind of doses you're receiving and what those effects are and what you can anticipate, and then connecting them to these trusted vaccine sites and clinics to get themselves and their families vaccinated.
Wonderful. Thank you. Thank you very, very much, Jennifer. We appreciate that overview. And I recognize the role in a virtual environment right now, but if we were in person, I would really want to pause right now and just ask everybody to give a round of applause to these organizations and these leaders who have done such tremendous work at a time of unprecedented adversity. So I'm going to clap here very, very silently, and I encourage everybody to join me in that as well. So we'd like to move on now to just a couple of quick questions, and we'll essentially follow the same order that we just went in right now, starting with Genoveva. So the first question I have is, so all three of you work with diverse but distinct communities to a large degree. And I'm very interested in getting your perspective as to what you feel are some of the significant challenges that exist to an equitable recovery from COVID-19 in the San Joaquin Valley and amongst your communities.
Make sure I'm unmuted this time. It's a really important question, Chris. And for me, I think there are at least 3 buckets of things that we really need to work harder at. And I would say the first is why so many of our community are vulnerable, right? Like, why are children struggling with food insecurity? Why are elders struggling with lack of access to healthcare, with lack of access to food, right? 2 areas that we dedicated our funding from Sierra Health Foundation to help address during this pandemic. And so for me, it boils down to poverty, the immense amount of poverty that we have. Why, right? Is it the exploitation? Is it the fact that many of these seniors were undocumented and weren't able to apply for benefits and programs that they were left out of, that they weren't getting stimulus monies to help support, right? The toll on what we call now as essential workers, right? And the exploitation that those workers have. So there's a lot of root causes to poverty that we really do need to uncover and work to address, right? In a more just system. I would say the second is what Pablo was talking about earlier, really to me grounds in the importance of building political power in the Central Valley, right? We need to make sure that we're driving investments to help address those issues that were the reason why we had such an unhealthy population to begin with. In the San Joaquin Valley, we have astronomical rates of diabetes and heart disease and asthma, right? And so we know that we were at jeopardy. 70% of the people in the valley who have died as a result of COVID were farm laborers, right? Or tied to agriculture employment in some way. And so these are communities that are living in places where there aren't parks, there aren't sidewalks, there overabundance of unhealthy food. And that's what's driving the development of chronic disease and chronic illness, right? So when we move back and we think about building back better, we have to address those infrastructure issues that allow all of us to live the full course of our life in optimal health so that we can be stronger and more resilient the next time some pandemic or some other crisis arises in our community. So I would say that political power helps us drive those investments into communities that are currently still very disadvantaged. I would say that the third is building our capacity, right? The education inequity that we have, the lack of people who have had higher education or academic success and accomplishment is not enough, right? We need to build those pipelines to prosperity and educational attainment in a lot more stronger and robust ways. So we definitely want those children that we're educating here to come back and work here. When we think about what made us vulnerable to COVID, we know that there are environmental things, right, that have caused, as I mentioned, these chronic illnesses. But we also know that there is a provider shortage that has been long-standing here in the Valley. We know that there is a deficit of healthcare facilities, healthcare places for people to get access to care. And we know that we're a region with the lowest enrollment, right, of healthcare coverage. So these are all things that I know are part of the iHeal platform that I'm excited about, including immigration reform, right? Because for a very large number of the immigrants living here in the San Joaquin Valley, we are being left out of a lot, from education to housing to stimulus to other resources that help to create more stability and resiliency among our population. So I would say that those are areas that we really need to focus on in building. We really need to understand what created the vulnerability. Those are deep inequities that have been here a while, and we need to make sure that we're reinvesting in addressing those issues so that we can have a healthier population and healthier communities.
Thank you very much. Felicia.
All right, I got the mute button. For us, significant challenges fell into a lot of different areas. So I'll pick a few key ones. One of them for our community is distrust. And so we got any and everything with COVID-19 vaccines and even coming in for testing initially, such as not trusting the government. I don't trust the vaccine. It was developed too fast. I don't know what's in it. I don't want to be a guinea pig. Like literally some people were telling us that. Others were just cautiously approaching, I want to wait a little longer. I want to see how it materializes with other people. Some people feel that because they already had COVID, they don't need the vaccine. So all these things are education challenges for us as an organization, and dispelling myths and really trust building. So that's definitely a challenge that exists for us in terms of equity. Another piece for us is really being focused on health disparities from a standpoint of being intentional with how we design our programs and what we provide for our clients and patients, even when we refer them elsewhere. So we are now tackling the social determinants of health, what we call 2.0. We have been doing social determinants of health assessments and risk assessments and needs assessments for many, many years now through other programs. But now we want to integrate it into our health record system. So when we provide someone with a medical visit or a medical appointment, it's not enough just to meet that chief complaint. It's about knowing and understanding all the other things in that person's life that will be or are affecting them. And so we want to design a program here, and it's definitely going to be a challenge, but to be more holistic in our approach. And so that's something we feel is going to be very important to close the gaps in the disparities that exist. And then finally for us, where we plotted our outcome data, our encounter data each month between 2019 and 2020, like for many people, you'll see a drop in the 2020 services provided. In our behavioral health services, we did not see a drop. We saw an increased amount of behavioral health services in demand over the course of 2020. Granted, we were fully virtual, and so it was all telehealth visits. And so we saw increased rates of anxiety and depression diagnosis, increased rates of domestic violence. No surprise to probably many of you on here, the increases in substance use and opioid use disorder. So these are all challenges that I think we knew existed in the community in terms of health and behavioral health needs, but the fact that it was exacerbated by the COVID-19 pandemic really puts us in a unique place for how to respond. And so that's a challenge for us. So we've got to think that through. We're trying to integrate behavioral health and medical services. So we're screening for things, for example, like alcohol use or substance use disorder during a medical visit, rather than waiting to refer that person or a person off to behavioral health for that screening and assessment. We're also screening for social determinants of health needs, creating stratifications by risk level so that we could be more responsive to those in need of other services other than just that medical visit. And I think for us, in terms of equity, is just being intentional about what we do with our youth. We're very youth focused, and it's about building resiliency within that population. They will soon be adults, and they will face their new pandemic of their adult lifetime. And so we feel like this is an opportunity to step up and talk to our youth in a different way. It's not just about graduating college or getting a job. It's about survival and perseverance and the resilience that's going to be required. We've definitely been tested in this past year, and we're very proud to still be standing and to have come out stronger. We're very excited about what the future holds for us in terms of stepping up to these challenges. And that would be our stance on that one.
Fantastic. Thank you very much. And Jennifer, same question to you.
Thank you, Chris. Yeah, you all didn't see me in the back, but I was just nodding in agreement incessantly when Genoveva and Felicia were talking, because it hit all the points and the marks I think that HIP or Hmong Innovating Politics we really are in alignment with. To begin, I think we definitely noticed so much inequity that pre-existed already, but was amplified even more in the wake of the pandemic. And I'm also thinking about, workers who were labeled essential, but we all can probably argue that they felt more expendable and at a risk more than anything. And I think about our Hmong community and the Sikh community who were continually having to work at unsafe places and not being provided personal protective equipment and gear. For example, at places like foster farms, where we know that there were high rates of contracting COVID-19, and this was putting not only the workers at risk, but their families and loved ones. And they had to go in lieu of, or it's either you make a living or you earn a living, or you're going to struggle during the wake of this pandemic. And that was a really hard place to be stuck between, or two hard places to be kind of stuck between. And so in equity, I'm also thinking about, and we're thinking about what recently passed was the American Rescue Plan and the hundreds of millions of dollars that are coming into the state and coming into our school district and our counties, and how we can uplift our communities to fight for, to get involved with budget advocacy and demand that these money and these funds be reinvested in the right places that are going to support them, because they've endured so much in this over a year, wild ride of trying to survive the pandemic and trying to stay sane. We know that mental health, as Felicia mentioned, has been at an all-time low for many people. It's truly impaired a lot of people. Children who've had to do distance learning and don't have the right resources and equipment and support struggle to succeed in school, struggle to learn, whether they didn't have safe places to learn, they didn't have the devices to connect, or this sort of new learning environment was just in no way supportive of their educational needs, nor the parents' ability to provide support for their children and students to succeed as well in this environment. Additionally, I'm thinking about, how we also compounded with not only just the pandemic and trying to survive and, live through this, was also the rising anti-Asian hate and sentiments that had come about, and that really compounded everything that people were experiencing, not only in the county and not only in the state, but I think the nation at large, and how recently HIP, along with so many other coalitions, was able to get this Asian American resolution to pass unanimously in Fresno County, and how that's a kind of a step toward recognizing that we as a community won't stand for senseless attacks and racism against the Asian American community, but any communities that are facing hard times, that we don't need that added layer. And so I think that's a step toward equity. And I also want to recognize what Genoveva had mentioned too, in terms of redistricting and recognizing that the Central Valley, we, for a small geographic area in the state of California, in the nation, we feed a quarter or more so of the nation from our resources of our agriculture and, our farm workers who are working there laboriously and risking their health and their life during the time of the pandemic, and how consistently we are intentionally overlooked and never invited to the decision-making table, and how we need to create access and channels and avenues to lift up our community voices, because they're the ones living in the communities, understanding and seeing and experiencing firsthand the disparities, the health inequities, the economic inequities and disparities that are going on, and how their voices and concerns need to be uplifted so that we reinvest properly into those channels and areas that can support our communities to thrive moving forward.
Thank you very much, everyone. I appreciate that insight, and then given how much head nodding I was doing in the background, and it was certainly something that that we feel very strongly about as well. So we have one final question, and many of you touched on it in your responses, because they are inherently tied very closely to one another. But building off of this idea of, there was the relief side of the work, the immediate relief. There was the recovery work that is going on right now, and oftentimes going on hand in hand with that relief work. But there's also this concept of building resiliency to ensure that our communities are more resilient to whatever the next emergent challenge is, be it another pandemic or what have you. So what do you feel can be done to support in building resiliency within our communities in the region?
So, you know, I think that one of the things that really jeopardizes us, jeopardizes people's earning potential, jeopardizes what resources they can participate in, it really creates the disadvantage, is our failed immigration system. Like by far among the Latino community, that would be something, if we had a just and fair immigration system, that would really benefit our community. But I think when I think about resiliency, it's how we make our community stronger, right? Like how do we get past those issues that create disadvantage? And so I see legislation and policy change bubbling up that's about, you know, universal foods for all of our kids, right? No child in the state of California should be hungry, and certainly not in the San Joaquin Valley. We are the fruit and vegetable bowl of the world. All of our kids, right, in particular because it is their parents and their grandparents that are picking the fruits and vegetables that feed this state and the rest of this nation. You know, Jennifer brought up the point about us being small. We are 1% of the agricultural farmland in the United States, and we produce 25% of all of the foods. No vulnerable senior, no young child needs to be hungry, right? So to me, I see that as a foundational thing that if we could set in place would really help us in a multitude of ways. It's less money out of pocket that impoverished or disadvantaged parents would have to provide for their family, right? It allows them to dedicate those resources in other ways to help support their family. In the same way, I feel absolutely the same way about access to healthcare, right? Like, again, in the world's richest nation, in one of the most prosperous states, right? In that nation, there is absolutely no reason where people should have to go without care. And in particular, seniors who have spent their lifetime picking the fruits and vegetables that have fed us, right? Our retired farm working community, it is a travesty what has happened to them with no pension, with no resources to back on, right? And it is why specifically we chose to make sure that they were fed and were not left without. So I think that there's a lot that we have to consider in terms of both our very young and our very old, and what we do to make sure that they're receiving everything that they need, you know, our youth, in order for them to develop healthy. We shouldn't be creating food environments or jeopardy in their ability to be outdoors and being physically active because we're prioritizing profit for corporations before their health. Right? You know, it's easier in the San Joaquin Valley to buy a soda or a chip than it is to get a fresh fruit or vegetable in the same rural communities where those fruits and vegetables are grown. And part of the reason for that is sheer economics. When families are impoverished, and if you're living in a community that doesn't have potable water, you're having to pay 3, 4, 5 times for a greater amount for water than actually purchasing a sugary drink. Right? You can get 2 liters of a soft drink, right, for nothing, but you have to pay so much more to get fresh water. So that to me are examples of injustice that we shouldn't tolerate here or frankly anywhere else. And so I want to make sure that as we're thinking about building back better, as we're thinking about how we build resiliency, that we really start with the fundamentals. What are the fundamentals to good health, right? Healthy eating and active living, right? Like those are 2 basic behaviors that we want to make sure everyone in our community can participate and be active in. That healthy food should be affordable. That healthy food should be ubiquitous in our schools, in our communities, everywhere. Every child should have a safe place to recreate. We should have parks, we should have sidewalks, we should have bike lanes, right? Like all of those things that prevent the onset of chronic disease later in life, right? And for those elders, we really need those service programs to continue, right? Because what is happening, the jeopardy that they're suffering isn't going to go away immediately. And many of them are suffering from long-term chronic illnesses. We know of seniors that are skimping on insulin, that they're not visiting their doctor frequently because there isn't transportation for them, because they can't afford their medications, because there isn't a doctor that they are connected to, right? And that shouldn't be happening either. And, I do want to underscore what Felicia said. We've been living through a pandemic. There has been so much stress in the lives of our children, in our elders, in our families. We need to prioritize good mental health. And in the same way that we are trying to build those pathways for healthcare access, we need to build those same pathways for mental health, right? So there is so much to do, but I think for me, the fundamental things are the important things that we do need to make sure get completed, and then build from there.
Thank you very much. Felicia?
All right, thank you. I think first, your question to support building resiliency with communities in the region. I mentioned earlier our interest in focusing on youth. The youth is our future, but being very culturally specific about that focus. So here at Fresno American Indian Health Project, and within the realm of research, we are very much tied to culture is prevention. And it's really about those foundational building blocks of resiliency, of surviving historical trauma, and thinking and planning towards the future, being intentional about it, that is going to drive us foundationally. So with a culture as prevention kind of focus, I mentioned earlier about just providing more whole person care, being a little bit more holistic about how we think about services. We are looking to purchase additional space where we're located to design what many dream of and talk about in terms of a one-stop shop. So when you're in the health center and you're here for your chief complaint of whatever, and we're providing medical services to you, if we know you're struggling with housing and you have an unemployment situation that's creating an income strain within your household, we want to be able to provide those services right here next door within our reach. So we do a great job with case management, but resiliency for the future within our communities is really about connecting them with resources and helping them to better themselves. So we really want to make that dream a reality, to the point where when we have these conversations about what that might look like, we're going back to Maslow's hierarchy of needs. I mean, we're getting very foundational with what does a human being need to be self-sufficient, to be self-determined, and to prosper. And it's just going to be a challenge, but we're ready to step up to it. Jennifer and Genevieve mentioned the youth. And so for us, we definitely have seen that stress and strain on our youth, both educationally and socially. Here within our organization, we were recently, actually in 2020, chartered as a native, one of 200 Native Boys and Girls Club in the nation, and one of 6 in California. So we want to keep our youth connected, and we're going to have to be creative with how to maintain that and support them educationally with our after-school tutoring programs and other skill development services, as well as providing them a social outlet. That level of seclusion that people have experienced, both young and old, over the past year is tremendous and uncharted. And so we have to think about how to maintain and establish and infuse culture as prevention as we move forward. And so working with our youth is going to be important. I and a couple other people in my organization are a little biased with measurement. And so with anything that we do, we're asking the question of, did it work, right? So we want to be able to, as we implement interventions, be able to measure before we do that intervention and after, to get a sense of, was it helpful? Did it work? How did it work? Should we do that again? Should we never do that again? And so we want to be informed about these steps and things that we're testing out, we're trying, and we're now doing differently. We just don't want to kind of blindly move forward in how we're trying to tackle the future and build that resiliency. And I mentioned our expansion, the whole person care, the youth, and I think it was Genevieve that mentioned the elderly as well. So in the Native American community, we very much value our elders. And so we're trying to do things to link them to youth. The level of isolation that this situation has created is beyond imagining. And so what it's done for some elders is brought them into the future, if you will, where that digital divide has been shortened, lessened, or eliminated, and they can attend virtual meetings. But for others, it has truly, truly shut them down and further isolated them. So we have a public health nursing home visitation program, and we're going to be very much watching that and studying that to figure out how can we help someone set up their computer, use their camera, unmute themselves when it's time for them to speak, or just be involved somehow, some way, because we know we have a geographic distance and a challenge here in the Valley to deal with. And in our mountain communities, where Genevieve just mentioned about the water access and potable water, we still have communities with no water access. And so it's just a challenge that will, it exists, but we're very interested in rising to the occasion and working through to build that resiliency within our communities.
Thank you very much. And finally, Jennifer.
Yeah, this is it's not a challenging question, but when I think about building resiliency in our community, and I reflected back to my upbringing, I'm super proud of being born and raised in the Central Valley, Fresno native. I've always seen that our community has always been resilient. And so I go to say that the resilience of our communities should not be an indicator that things are going right and great in our community, because historically we've always done or been able to do a lot with less. We make do with what we have. And that is the status quo that we want to move beyond, because we know that there is enough for everyone. And oftentimes our communities are left to fight for scraps. The constant myth that there's not enough resources, I think is just something that we are always continually resisting and fighting against, and holding those accountable, and demanding the right resources and equity back into our communities here in the Central Valley, here in Fresno. We have to push back against the status quo, and again, bringing back to our young generation, I think, or our future. The future is our young people, and reigniting a new generation of empowered youth leaders who aren't going to settle for less for their communities. And we have to do better. And that is why I think, I reflected also back to HIP civic engagement work. That's what we are pivotally known for. And we're super proud of when we phone bank and we canvass to community members who've never had these conversations about voting, about what they're electing or who they're electing, and what propositions they're voting yes and no on, and why and how it's going to impact them moving forward. Again, just back to centering the community voices and their needs and putting them at the table, because they know what they want and need, and those needs and wants need to be heard and be given. I think what our community needs is it's not radical and it's not luxury, it's basic needs. Basic human needs in the Central Valley. And it shouldn't be a question of having to fight for it. Keep it short.
Thank you very much, everybody. I appreciate all of your insight. I appreciate all of your hard work and your commitment and your dedication to our community. So thank you again. The virtual round of applause for all of you for supporting our communities through this pandemic. Now, before we get started on our last speaker panel, let's take a little entertainment break. So please help me welcome Adid Medina, a truly talented spoken word artist from the San Joaquin Valley, to the stage. So Adid, handing off the virtual mic to you.
Hello everyone, my name is Adid Medina, and this is my poem for Equity on the Mall 2021. A place. Begin every day with sights on each and every opportunity, not just to survive, but to live. With a place to call home, a place to be safe and well fed of mind and body. This is what we dream of for our neighborhoods. Equity in action, working together, you and I, ensuring that the air and water are clean for everybody. that our schools and libraries house the books and hopes on which to reach the next level of books and hopes. This justice should be more than just a fist, should include a sense of shared existence. We exist with the earth and its waterways, with plants and animals, with our neighbors and with strangers that we will never meet. My life is connected to your life. Your life is connected to the next person. When I sit down to a meal, may I have ensured that there is a meal on your table as well. This is a mandate to create a world that we can all live in without fear of persecution, homelessness, hunger, and despair. This is a mandate, and equity is a place that we can find together. Here, in this neighborhood, health and safety would be considered before profit, and laws would protect, not execute, its citizens. In an equitable world, every neighborhood would afford its people the opportunity to walk out and reach for their neighbor's hand. A weekly porch festival, a celebration of life, of little libraries, of shared meals, and meals on wheels for those that are shut in, and health and mental services for those who are struggling. And we would know poverty would not be a crime, but a chance to fix a link in our support systems, those of our human existence. On this day, we proclaim we are heading there together. Thank you very much.
Thank you, Adid Medina, for that fantastic, wonderful performance, and for all the amazing talent from throughout the San Joaquin Valley. We are so tremendously lucky to have so many wonderful local artists that represent the rich diversity of our region. So next up, we have a very important discussion, as the impacts of the digital divide have never been so clear since we all began to work and learn and exist at home from a virtual environment. So let's get started on the digital divide in the San Joaquin Valley panel. So on the panel joining me today is Eduardo Gonzalez from Fresno State University, Dr. Gabriela Sandoval from the Utility Reform Network, and Deep Singh from the Zircon Movement. So please join me in welcoming my three panelists. So good morning, good morning, panelists. I would like for us to start by asking each of you to describe your own work around the issue of the digital divide, and as well introducing the recent work of the Digital Divide Working Group that the San Joaquin Valley Health Fund supported. And we'll start with Deep on this.
Sure. Good morning, everybody on Equity on the Mall. Great to be here. So my journey into the digital divide has in some ways been curated by some of the other panelists and a number of sort of remarkable individuals that I've had the opportunity to meet and engage with over the last few actually months now. You know, in some ways, I have two approaches to this question. There's one sort of organizationally, which the digital divide was something we were keenly aware of, but not something that as an organization we had necessarily spent a lot of time with. But in another world, sort of as a school board trustee, it was something especially for Central Unified in Fresno County. It was something I was keenly aware of in terms of as the schools were transitioning to sort of our pandemic world and really seeing both the disparities, but especially the inequities that were already there, but really sort of come about and become amplified during the period of the pandemic. And so it was Chris, Ellen, a number of team members from the San Joaquin Valley Health Fund who had actually approached myself and Luisa Medina of Central California Legal Services to begin kind of exploring a conversation on the issue of the digital divide in the San Joaquin Valley. I got to meet some really great individuals along the way, especially Eduardo Gonzalez, who will be speaking shortly, Sunny McPeak, and so many sort of key individuals to really understand the landscape of those that have been working on this issue much, much longer than I. And so, you know, as we go through the course of this panel, I hope to kind of share some of the insights that I've gleaned from them, and I'm sure they're going to have some of their own unique insights themselves.
Thank you very much, Deep. So Eduardo, we'll turn it over to you now.
Perfect, thank you. My name is Eduardo Gonzalez. I'm the Interim Executive Director at the Office of Community and Economic Development at Fresno State. And we manage the San Joaquin Valley Regional Broadband Consortia, which covers the entire San Joaquin Valley and 8-county region. For about 8 years, we've been specifically focused on 3 main goals. One of them is infrastructure, anything to do with broadband infrastructure and how we get deployment of broadband to urban and rural communities. 2 is how to get adoption of, now that we have the ability to connect to broadband, how many families were actually able to connect and provide that information to low-cost internet options for families. And the 3rd is really digital inclusion, allow for parents to and students to be to have the skills necessary to be, you know, part of the digital world, and that includes digital literacy. And so our main purpose here on the committee was specifically to look at infrastructure. And as the pandemic hit of last year, you know, March 2020, we received thousands of calls because everybody had issues with trying to figure out where and when they were able to connect. Specifically, a lot of the school districts, because they weren't mapping where the students had internet service or where they didn't. Communities, I would go into a community and ask, do you know where all your assets are at? Do you know what broadband providers are in your community? And people just didn't know. They knew the importance of it, and it was on the radar, but it wasn't top list, right? And so pandemic hit, March 2020, broadband became one of the top, top issues and purposes of people engaging in broadband. And so that's ultimately what we did, and you will find out throughout this panel that we're able to engage not only the internet service providers, but the community itself, stakeholders, community leaders, all around the same goal of providing adequate and equitable broadband for all.
Thank you very much, Eduardo. Gabriela.
Yeah, thank you, Chris, and thank you to the San Joaquin Valley Health Fund for having us. I am the Director of Strategic Initiatives with the Utility Reform Network, and TURN, as we're often known by our acronym, has been around about 50 years. We're getting ready to celebrate our 50th anniversary, and we have, in those 50 years, been advocating at the California Public Utilities Commission for safe, reliable, and affordable energy, as well as telecommunications. And we definitely saw the pandemic as an opportunity to really begin to push harder for something that we knew was already incredibly important, namely internet access or broadband access. And so similar to what Eduardo shared, we look at this question through a multi-layered approach, looking at adoption, availability of services, affordability, the access to technology, digital literacy on the consumer side, and of course the perceived relevance, because we know that a lot of people don't yet understand how important internet and broadband access are. So our approach is always to bring the stories of the people who are living this experience to policymakers, because we know that this is a very important way to move the hearts and minds of folks. So I just want to share one brief story that someone we worked with in the Valley shared with us recently. The story of a single mom with 3 children whose broadband availability and access only allowed her to have 1 child online at a time. And so the kids were rotating school doing 1 day, sometimes 2 days a week. She had 3 kids, so one child Monday, one child Tuesday, one child Wednesday, and then rotating again on Thursdays and Fridays. And so this gives you a sense of the types of stories that we're looking for. We're story banking these experiences of people in the Valley around education, such as for this particular example, but also employment, housing, and health. Telehealth has become incredibly important. And so we are using those stories as a source of data, as well as the data that's been gathered, for example, by the consortium that Eduardo mentioned earlier, on where exactly there is availability of certain speeds of access. And we plan to take all of this data, both the formal data and the stories, the anecdotal data, to our policymakers and really begin to move the needle on what is a very important basic need.
Thank you very much. And thank you to all of you for those introductions and that insight. So, you know, when we often discuss the digital divide, we discuss it in a very similar way to many of the other inequities that exist within the region. That, you know, COVID-19 did not, you know, create a new challenge, a new inequity in the region. It merely highlighted and magnified and amplified something that was already existing. So with that in mind, I wanted to ask a particular question around that, and we'll go in the same order as the introductions, but just to get a sense from all of you, what do you feel are some of the most significant challenges related to bridging the digital divide in the San Joaquin Valley and among San Joaquin Valley communities? And Deep, we'll start with you.
Sure. So to your point, Chris, I think oftentimes when you look at coverage areas for in terms of what is the type of broadband access, what is the type of just sort of internet access available, oftentimes it will map very closely to these sort of inequities that you were earlier describing. When Luis and I first sort of had an opportunity to really engage in an issue that neither of us had any previous expertise in, when we were talking to partners in rural areas of Tulare County, in areas of Kings County, in areas of Fresno County, Kern County, even Merced, more often than not, that was the conversation coming up over and over again, is that, look, there are systemic reasons for why our valley is shaped the way it's shaped. And this sort of digital divide continues to further in-bake those inequities. And unless you have whether it be from telecom agencies, but many people didn't have necessarily faith that the free market alone is going to be the group that sort of solves these issues, to other regions that some in our valley that have been actually at the forefront of creating sort of creative opportunities. I want to lift, for instance, in Kings County, where in the school district, like over a decade ago, was one of the first groups that actually recognized that how important it was for the students to have reliable internet access. And it was actually school districts that were really at the forefront of providing some of these services. And so, you know, you have a huge coverage areas. In our own Central Unified, for instance, Biola, a small census designated community west of Fresno, where access is still sort of limited, although there are more and more infrastructure that is being built out. You know, you have a patchwork throughout the valley, and it very much does overlay in terms of maps of other types of inequities. And you're going to need an all hands approach. I think, you know, the telecom industry, which is the largest sort of way to sort of and has been in terms of creating coverage areas, it is a Oftentimes these are monopolies created by the government, so that actually people do have a lot of influence, oftentimes more than they even sometimes realize, although that takes concerted effort at the local level, at the federal level, to make sure that those monopolies that are being provided by government allowance is actually going to serve all residents and not just a few. As well as you will need local initiatives, for instance, like school districts, like cities, not in the Central Valley, but in other parts of the state. Municipal broadband is a possibility, and so you're going to need a multivariated approach, and that's the only way that, if we're going to really seriously address these inequities, then one has to take a multi-pronged approach.
Thank you very much, Deep. Eduardo?
Yes, and I'm going to agree with Deep. Is we need to stop having industry control the way we run broadband in California. California needs to take control of what the industry provides and how it provides it, and that's it becomes an equity issue. And it's in the Valley. It's been like that for years, and we need to stop having the internet service providers, the big telecoms, tell us, yes, I'll serve your community. No, I won't serve your community, just because they want to make their return of investment work out for them, right? We understand their companies. We understand they're trying to make money, but broadband is something that needs to be treated like a public utility, and just like water, just like electricity. They need to be regulated and needs to be provided to every Californian to be able to have high-speed, accessible, and affordable internet service at their home. So just this past year, we were able to put a preferred scenario and identify 46,000 households in the San Joaquin Valley, just in the Valley, that do not have internet infrastructure. So regardless if they wanted to pay $100 or $150 a month for internet, they just can't. One, they can't afford it. They can't connect. And so how do we deal with this? Well, Deep mentioned a little bit. It has to be different types of approaches. One of them might be a municipal broadband. Some might be school districts coming in. Perfect example, KingsNet. They did that 10 years ago, and we were surprised that no one else followed, right? And they came in and said, look, if the internet service provider is not going to serve our communities, then step aside and let us deal with that. Because ultimately, there are residents, there are kids, there are children, they're the ones that live and play in our communities, right? And so how would we come up and say, well, if you're not going to do it, step aside and let us do it? And that's where the policymakers come in, that they need to understand that. They need to understand that we need to stop this industry just coming in and say, yes, I will provide at this location, but at this other one, it doesn't make sense because everybody's going to qualify for the low cost internet offered. And I'm not going to get the return of investment. We need to stop doing that. We need to make sure that we create these partnerships that are able to look at potential assets, middle mile that's accessible, and be able to tap into that so that we can provide broadband for rural communities and low-income neighborhoods and urban centers. And so that's one of the things that we would have to do to face this challenge of broadband.
Thank you, Eduardo. And Gabriela?
Yeah, I want to agree with Deep and Eduardo and go back to something Deep said about coverage areas, because what we know when we look at maps of what is available to folks throughout California in terms of internet and broadband, when you map the speeds and the access, we see that the Valley stands out. So the providers who provide broadband service in the Valley tend to be smaller providers. They don't have economies of scale like the big, the big providers we hear of in other parts of the state, where there is access to faster, more reliable, better service. So I want to agree that that coverage piece is critical, because it doesn't even matter whether or not people can afford service if you simply cannot get it, if it just isn't there to be purchased. So I think what I will say in terms of addressing that problem is that we have to organize. We have to organize, bring our communities, their voices, and their lived experiences to the policymakers. And, I think one of the great things about the work of the San Joaquin Valley Health Fund is precisely this event, where people learn about how they can bring their voices to Sacramento. But we also need those voices with respect to broadband, at least at the California Public Utilities Commission, because most people don't even know that the commission exists, let alone what it does. And so this is a critical issue where the commission has a very critical role to play. Eduardo mentioned regulation, right? And most people don't know what that means and how they can bring pressure to bear at the commission. And so we really think that that is a kind of critical missing link in terms of, we already have lots of very well organized communities, but they're not deployed in this particular space. And so that's one aspect of the work where TURN can really help to bring those voices to the commissioners, and to really find ways, creative ways. I love Eduardo's idea of like, well, let's do it ourselves, right? Like, let's create municipal broadband. So yes, absolutely, to all of what's been said, that multi-prong approach, the education piece, and definitely the organizing, the community organizing piece are going to be critical in this fight.
Thank you very much. Now, to close, I want to give each of you an opportunity to answer what briefly what is perhaps a fairly complicated question, perhaps, and that's really this idea of building off of that. How do you get involved? If you're sitting in the audience, like many of our attendees today are, and you're wondering, great, the San Joaquin Valley Health Fund has incorporated digital divide into the policy platform, but how do we act? How do we organize? How do we move forward? How do we make our voices heard? If perhaps you're coming to this issue like Deep did a few months ago from perspective of being a newcomer on this particular policy area. So just just very briefly, but if each of you could sort of touch on your advice to everyone, starting with you, Deep.
First thing, make great friends like Gabriela, Eduardo, and Sunny, because to really understand the issue, you have to know a little bit what happened before. So because there have been people that have been advocating, fighting for this for a long time, and so. I was, very gung-ho. How do we get, municipal broadband? Because I enjoyed it myself, actually, as a graduate student in Culver City, but and I could only dream of something like that. And then there were laws passed that made that unavailable. And then there have been laws that opened up late during the Governor Brown's administration that has put that on the table again. So one thing is you have to actually understand, talk to people. You have some great members of this panel, email them, continue those conversations. But then it's really a lot about organizing. It's really, as I'm understanding, there are various tables where we can raise our voices collectively. Equity on the Mall and the San Joaquin Valley Health Fund give us opportunity to have regular conversations to make sure that our assembly members, our senators are not just not just allies, but actually champions of this issues. And there's a lot of things one can do in various governmental arenas. As Eduardo shared, it's not only just to look for Sacramento or Washington, D.C. You can really start at your school board level, right? It's about, which is that sort of most intimate, most local level. It's really about what do you dream? What do you envision? And to Eduardo's point, Dr. Rambula said, that medical coverage is a human right, and in this kind of digital age we live in, access to the internet is also going to have to be understood as a public utility and a fundamental right for all American residents. And so, and possibly even beyond. And so we only do that when we organize, when we come together, definitely learn about the issue. There are places where work is already happening. Let's find ways to amplify their work, organize, and put a lot of pressure, like I said, from your school board to Washington, D.C. and everything in between.
Thank you. Eduardo?
Yes, definitely. I'm going to agree that you have to get your local leaders involved, community leaders, your nonprofits. Every nonprofit is affected by broadband, regardless of what their goal is. If we just heard the last panel talk about specific issue, and broadband was mentioned, and so we need to understand that broadband is, if there's a time for broadband, it is now. And you need to be involved regardless of what organization you represent, regardless of what community you're in San Joaquin Valley. Get involved with your community leaders. Talk to your local representatives from city council, school board, to your elected officials. Get them involved with not only the infrastructure. If your community already has broadband, talk about the digital inclusion. Is there enough equipment for community members to be able to purchase it? Do they know how to use it? Is there digital literacy classes in schools? Sometimes we connect with schools and they say, no, we don't need the digital literacy. Our children have the one-on-one computing devices. Well, yes, but those computing devices are going home, and parents can't support their children's education because they don't know how to use the equipment. So, think about those. So if you are in a community that doesn't have digital literacy training, ask for that. Get involved. If there's organizations that are doing on-the-ground work that are specifically working with the specific target population, and they want to map how much broadband or who's adopting to broadband, or whether they know how to get online, do that. Do a survey. Get involved with us. We can do a survey. We can map your community. We can find out the speeds. Sometimes a lot of communities come to us and say, well, we do have X, Y, and Z company in our community, but residents keep saying they pay $50 a month and they're not getting adequate speeds. And when we go and do the test, sure enough, the company's taking advantage of their $50 a month, and they're giving them less speed than what they sold them for. And so we don't know that, and our community members don't know that. All they know is that they're paying a bill and they're getting some kind of service to their home. And so if you're an organization and you start seeing that, or some of your constituents or clients come to you and asking for that, connect with us. Be involved in our work groups. And I love that now that the pandemic hit, there's 40, 50 organizations asking us, how do we get involved? And so this is the time. Like I said, if broadband had a time, it is now.
Thank you. And Gabriela?
Yeah, I'm going to reiterate some of that too. That's the downside of being the last speaker, right? But I love it. I love the idea of, yes, make friends with us. I'm going to reach out to Deep and Eduardo after this for sure, because we're stronger together. Absolutely. And the one thing I will add is, if you or some of your clients have a story to share, please don't hesitate to reach out to me. You can find me at turn.org. We also have calls to action, so you can just sign up for action alerts at turn.org/actions. Your stories, both as service providers or as individuals, are invaluable. That is the meat of what gets us to move the emotional center of policymakers' decision-making abilities. So do not underestimate the significance of the stories you hear from your clients, of the stories of your own lived experience, the stories that you can tell about, internet access, internet adoption, digital inclusion, all of those, that's the jargon we use, but it's those stories that actually operationalize what that means, right? What it means to actually help an elder access telehealth. I mean, that is what we need. And so if you have a story to share, please, by all means, reach out to me, reach out to anyone on our staff, where you can find us at the website, and let us know. And if you sign up for alerts, and this is the critical piece, right, then we'll let you know when there's a public hearing. in your community, or we can actually work with your organization to bring a public hearing or a town hall that includes policymakers so that they can hear directly from the folks who are most impacted. That is just like a critical piece that we know. We've been doing this for a long time. This is part of what we do. And so, yes, if you'd like to share a story, by all means, do not hesitate to reach out to me. And like I said, Eduardo and Deep, you will be hearing from me for sure.
Thank you very much. And Deep, you had one more comment you'd like to make?
I did. I just wanted to just ground what Gabriela was concluding with. You know, many of us saw that image of those two children outside of Taco Bell, you know, in Salinas, California. But that's not a story only in Salinas. I saw the same thing at the McDonald's on Clinton and Brawley and Fresno and throughout our valley. If we're going to make sure that that is not an image, that is not an education for us, then this actually has to be one of the most critical conversations in all parts of the IE-HEAL policy in any way that we're going to really achieve some equity here in the Central Valley.
Thank you very much, Deep, and thank you very much to all the panelists for sharing the incredible work that you're all doing to close the digital divide. So if everyone could please join me in a virtual round of applause for them. I'm tremendously grateful for your partnership, for your leadership, for your camaraderie, and I look forward to the work that is yet to come. So thank you. So thank you as well to all of our speakers and to our entire community for this phenomenal kickoff to this week of action that we've built around equity on the mall. When we first started planning this event in October, we weren't entirely sure whether we would be able to do this, you know, whether it was possible to have an equity on the mall without that vibrant in-person energy. But we committed to it, and through the excellent partnership that we have with all of our community organizations, we're able to bring you this. And I'm tremendously grateful for all the hard work of all of our partners, of my team at the San Joaquin Valley Health Fund, at the Center at Sierra Health Foundation, and Sierra Health Foundation as a whole, for everything that they did to contribute to making this possible. So we have a great show for you for the rest of this week. I encourage you, if you have not already gone and registered for the events that are listed for the rest of the week, please visit our website at equityonthemall.org, where you can register. We're going to have at least one event per day that represents each of the individual IE-HEAL policy platforms. So there will be events that will be focused on immigration, health, housing, environmental justice, education, land use and planning, all in a variety of different formats, and that we're really excited to bring to you. So we look forward to an amazing week with you all participating. Thank you again for attending today. And always remember, the Valley is rising. Thank you. Have a wonderful day.
Another moonless sky, I rise before the light, chase down a better life, I claim the power, block out the words of doubt, keep them from getting loud, dare you to stop me now.